The use of complex structural models actually has a long history, dating back to the beginning of implant technologies. At a time when the immediate post-war implantologists were heading to the type of implant prosthetic solutions that could guarantee immediate function, have begun employing implant systems which in the eyes of today can appear just a little bit strange. I am talking, for example, of the needle implant that was the implant that had great success in the 60s, 70s and even earlier. In reality, this implantology technique has been very useful to understand what was the creation of a complex structural system and what contributed to the reaction process within the bone system. It is no coincidence that Professor Mondani, to whom we owe the creation, say, of the first intraoral welding machine, was a great practitioner of this type of implant that had its own system integration as a weak spot, because the integration itself was performed with ligatures that then, for fatigue processes, could become loose and therefore give rise to the loss of the system. Professor Mondani had understood that the need for a long-lasting bond was the necessary condition for the implant system to have a long life. The reason why we have created this first intraoral welding machine, which later was modified to the circumferential syntherization we have now, with the latest machines that enable us to produce a bond system between implant and connecting rods that practically does not manifest any more defects or inconveniences that can give rise to the loss of the mechanical characteristics of the system.